The 7th Annual Digital Health Hub Foundation Awards seeks to find the most impactful and disruptive digital health companies. Out of 1,500 submissions, only a select few have become finalists. Let's learn what their superpower is.
Step 1 is we connect to your EHR and other data sources, or you can also upload your own files. Asepha pulls medication information from any source: prescriptions, MARs, discharges, home care assessments, you name it. It flags discrepancies such as duplications, omissions, and new medications in seconds. History of compliance can also be assessed based on previous fill dates and quantity. Open the result, and you'll see a reconciled table with alerts and clarifying questions, all in one place. This gets you 90% of the way there. The pharmacist then reviews and confirms the information before Asepha generates a clean medication list. This cuts down the med reconciliation process from 45 minutes down to just 15. Asepha is created by pharmacists and engineers who were previously at leading AI organizations such as OpenAI, AMD, and Microsoft. Enterprises across 3 countries and their pharmacists are already using Asepha on a daily basis to capture new revenue without increasing headcount. If you want to learn more, please reach out at our website and we'd be happy to chat.
Now hear in their own words why they should win.
Hi, I'm Eunice. I'm co-founder and CEO at Asepha. We are creating AI agents that help pharmacists automate their manual work. I'm a pharmacist by training. Essentially, I was very frustrated with manual work taking time away from patient-facing care, so I left practice to build Asepha in order to give that time back to pharmacists. Today, a couple of Asepha's tools, we automate everything from form filling and documentation. So we have a OCR or a vision model that is able to extract all the faxed information or all the handwriting information and enter it into the PMS or EHR automatically. We have a call and SMS agent that is able to handle non-clinical requests such as refill requests, pickup reminders, appointment booking, appointment reminders, etc. And we're also able to help the pharmacists identify areas where they're being under reimbursed in a couple minutes rather than in a couple weeks or a couple months. Our end vision with Asepha is to put everything for our patient journey into one LLM context window. What that means is that each area of care, so pharmacy, nursing, provider side, everything is connected together so that way a patient, especially a specialty patient who repeats their information quite often, does not need to continuously repeat their information across the different modalities of care. So we have this interconnected system where all the patient information is localized and we have all the proper information needed to make a decision. What's special about Asepha is that we're built by pharmacists and developers who have worked in the pharma industry. So we are building this very much with pharmacists in mind in order to bring up a software that is the most useful for these pharmacists who will actually be using it. Why we think our company should win. We're only a 2-year-old company and we're already live in pharmacies and being used every hour for the pharmacies who are using us. We essentially are cutting down the processing time of prescriptions by around 75%. So it's taking a lot faster in order to increase the access of care. And we're also essentially turning the turnaround time in some areas from moving from hospital to long-term care or long-term care to outpatient from 48-hour transition time down to around 24-hour transition time. Let us know if you have any more questions, but thank you for listening.
Follow their journey as they reach for greatness against a very strong field. Join us October 20th for the final showdown at Health in Las Vegas to witness the winners crowned.